Hello. Today, we will be discussing the policy on tubing misconnections in healthcare settings. The purpose of this policy is to establish guidelines and procedures for healthcare providers to prevent and address misconnections of tubing and catheters. Misconnections can have serious consequences for patients, including injury or death. It is important for healthcare providers to be aware of these types of misconnections and take steps to prevent them. Nurses and doctors are responsible for following this policy in both inpatient and outpatient settings. The policy outlines different types of misconnections and the risks associated with each. These include lower misconnections, wrong site misconnections, wrong patient misconnections, wrong procedure misconnections, and over-the-needle misconnections. To prevent these misconnections, all staff members are responsible for identifying different types of misconnections and the risks associated with each. Staff members must be trained on the different types of misconnections and the risks associated with each. Misconnections must be reported immediately to the appropriate supervisor and documented in the patient's medical record. Quality improvement measures will be implemented to track and reduce the frequency of misconnections. Another important aspect of this policy is the proper labeling and identification of tubing and catheters to prevent wrong site or wrong patient misconnections. All tubing and catheters should be clearly labeled with the patient's name, date of birth, and medical record number. Each tubing and catheter should be clearly labeled with the intended site of use, including the specific location and purpose of the device. Staff members who are responsible for connecting tubing and catheters should be trained on proper identification and labeling procedures. Any discrepancies or errors in labeling or identification should be immediately reported to the charge nurse or supervisor. The policy also includes guidelines for connecting and disconnecting devices, including the use of standardized fittings or color coding systems. All devices should be connected and disconnected using standardized fittings or color coding systems. Staff members who are responsible for connecting and disconnecting devices should be trained on the proper use of standardized fittings or color coding systems. All devices should be checked for proper connection before use. In summary, this policy aims to reduce the risk of misconnections and improve patient safety by identifying different types of misconnections and the risks associated with each. By following the procedures outlined in this policy, healthcare providers can take steps to prevent misconnections and ensure the safety of patients.